Hi, my name is Leandra Owens, and today we will be talking about herpes zoster, also known as shingles. Originally, it is diagnosed as the form of varicella zoster virus, also known as chickenpox, and that enters your body through the air in the form of droplets that enter the nose into your bloodstream. After the chickenpox remains dormant in the dorsal ganglia root, it becomes reactivated as shingles. It can remain inactivated for years. It's unknown why or how the virus is reactivated. It is thought to be triggered by stress, immune deficiency, or main cause seems to be age. The diagnosis for shingles includes tingling, burning, numbness, itchiness, and pain around the affected dermatome. 48 to 72 hours after these symptoms occur, a red rash appears that can be in the form of pus-filled lesions that looks like blisters, such as this picture right here. You can see the rash. Also, I have a picture here, and this is a picture of how the stages as it goes through the skin. As stage 1, the virus awakens. Stage 2, the nerve swells and the virus travels to the skin. 3, bumps and blisters form. 4, it clears. And 5, hopefully this won't happen, but a lot of people get post-herpetic neuralgia. Also, it can be located on the chest, the waist, the face, and sometimes your legs. The dermatomes involved are the T3, L3, and cranial nerves. It can be in a diagonal direction of the dermatome and is located on just one side of the body. About a week after about a week of this, the lesions will dry and scab. This picture right here shows some of the common sites that shingles occur in. You can see here the thoracic region is the most common, the neck and shoulder area, and the back of the head. Complications that occur can be during the facial shingle outbreak. It can get into your eyes and cause blurry vision and blindness if not promptly treated. It can cause Ramsay-Hunt syndrome and Bell's palsy associated with hearing loss, dizziness from ear lesions, and loss of facial feeling. And here is a picture of a lady that is experiencing shingles, and it has gotten pretty bad. Post-herpetic neuralgia I was talking about earlier is a chronic pain after the outbreak. It can be never-ending, dull, sharp, or burning pain. The most common symptom is it is the most common symptom experienced after shingles occur, anywhere from 3 months to a year after the virus has had its outbreak. This is the #1 cause of the therapy, physical therapy, in the post-shingles patients because medication seems to not work. It's commonly misdiagnosed because the rash and the lesions don't appear until after the pain. Physicians tend to think it may be a chest issue. The best way to diagnose is when the lesions appear. You can use many tests, the polymerase chain reaction test, to take a sample of the DNA from the rash. The direct immunofluorescent assay is another way. It uses a fluorescent antibody technique. You can also use a viral culture, which checks for the virus in the bloodstream, but it's usually hard to get the DNA from that, so it's not very efficient. The groups affected by the shingles are people who have had chickenpox before, but it reoccurs in adulthood. So 90% of adults that have had shingles had chickenpox during their childhood. Mainly occurs in people 50 years old, 75 years old and up, your chances increase. And after the age of 85, there's a 50% chance that a patient has or will have shingles at least once. Also, immunosuppressed patients such as HIV, lupus, lymphoma, and leukemia, people can be affected by the shingles. The prognosis is a full recovery, 7 to 10 days. The lesion should disappear 7 to 14. The pain can last 30 days to a year. Common treatment now is the vaccine Zostavax. It's a refrigerated live virus. It decreases the chances of shingles and the pain associated with shingles. It's currently for only elderly people age 50 and up. Most effective in people who are older than 70. You can also use antiviral agents such as Aclavir and Valtrex, which are the most common medical treatments. Best used 72 hours after the rash is presented. Corticosteroids can also be used to help with the pain. Analgesics and nonsteroidal anti-inflammatory drugs can be used, such as ibuprofen, aspirin, and some narcotics. Nerve block injections and epidurals seem to help with the pain, only last up to a day. Low-dose tricholytic antidepressants help. Natural treatment options for people who are immunosuppressed that are getting immune to actually taking Aclavir, but vitamin A and C helps to increase your cell-mediated immunity. Some physical impairments and functional limitations are chronic pain, muscle weakness in upper and lower extremities, decreased range of motion, dizziness, loss of sensation, difficulty maintaining balance, walking long distances, inability to have active daily living. You have to rely on other people to help you get to work or even perform your job or help put on your clothes because your skin's so sensitive to touch. Physical therapy that can be used. Most common is a TENS unit, usually at home, or you can even do electrical stim in the clinic. When electrical stimulation is added to your medical treatment, there's a 60% of cases that have shown that they have better improvement in their pain. You can set the TENS unit to 15 to 150 hertz. Gate control theory, and the pulse duration 15 to 500, and the intensity is determined by the patient. Estimated treatment time is 15 minutes. They can use it as much as they feel like they need to, with a rest in between. To placement of the electrodes is usually wherever the rash is located. You would put it above and below it. You never place the electrodes on the actual lesions because it'll cause them to spread and also cause the therapist to probably get them also. Facial strengthening for patients who have experienced hepatic facial paralysis such as Bell's palsy result from having muscle re-ed and strengthening for those facial muscles that were affected by the shingles. Exercises like smiling, frowning, and acting like you're kissing someone or drinking from a straw tend to be good exercises that have shown to help. The first visit you can start out with easy things and then work your way up to doing multiple facial expressions. As far as the therapeutic precautions and contraindications for therapists, ultrasound and hot pack are not good to use because the heat can cause the outbreak to spread. Also, if the patient is in or has the outbreak occurring, don't touch the lesions or put any modalities on that area. You'd need to educate people with shingles so they don't spread it. They need to stay away from pregnant women, infants, HIV, and cancer patients because of their low cell-mediated immunity. The safest way to not spread it is to just stay inside until all your lesions are dry or completely gone. And the closing statements, vaccines available now, so you'll see a significant decline in probably your elderly patients. Prevention methods like the vaccine and is helping out with the pain. Physical therapy, the TENS and the exercise can help easily control the pain, and effects can be lessened through that. The majority of us have probably had the chickenpox when we were younger, so we will all probably at some point in time may possibly have the shingles. To close this up, I had a little joke. It's about a guy that went to the doctor's office. He had the shingles. The nurse took down his name, address, and such, and he